Good morning, everybody. I'm Dr. Rashid Fakhri. I'm willing to speak about antibiotic resistance among war-wounded patients in Amman Hospital. So since 2006, MSF started a reconstructive surgery hospital in Amman. Till now, we did more than 12,000 surgeries for more than 5,000 war-wounded civilians from Iraq, Gaza, Yemen, and Syria. From the early days of the project, we noticed that there is a high rate of infections, a lot of patients coming infections, and it's reported in one of the literatures as 2/3 of the patients arrived infected. Osteomyelitis arises from commensal flora, from environmental contamination, or from intra-hospital transmission, and we can expect that from the bad conditions of the hospital at war zone. Usually, they lead to serious consequences on patients' outcome, and they are difficult to treat. Moreover, considering the antibiotic resistance would add more to the problem. So here we are describing bacterial etiology of osteomyelitis and the proportion of first-line antibiotic-resistant bacteria. All the patients were war-wounded patients admitted to MSF reconstructive surgical program between 2006 and 2016 with bone tissue cultures during first surgery. This is one of the peculiarities of this study because it's concentrating on bony tissues during first surgery, and this was a trial of the research team to avoid the bias of contamination. Culture results were collected prospectively and analyzed retrospectively from the laboratory database WHONET data. So 727 patients were included. 77% had one or more positive cultures, so they were osteomyelitis cases. They were mainly young adult male from Iraq, and they are coming with an average of delay of 19 months after the injury with the four previous surgeries. And this is again one of the characteristics of the project in which the patients are coming late to have the treatment and reconstruction after the war injury. 19% of the patients developed polymicrobial infections. Regarding the bacterial isolates, Enterobacteriaceae with its subgroups, subbacteria, represented around 31%, while Staph aureus was the most common single pathogen, represented around 26% of the cultures. Pseudomonas aeruginosa represented around 14%, and this is worrying because Pseudomonas aeruginosa is well known by its ability to have failure of treatment and recurrence of infection after treatment. Acinetobacter baumannii represented around 3%. Regarding resistance to first-line antibiotics, Enterobacteriaceae had 86% resistance to third-generation cephalosporin, and this is maybe one of the highest reported in the literatures. It's very high rate. Staph aureus had around 60% resistance to methicillin. Pseudomonas aeruginosa had around 50% ceftazidime resistance, and Acinetobacter baumannii was resistant in 3% to carbapenems. Regarding some antibiotics of interest, the fluoroquinolone group, ciprofloxacin, which characterized by its ability to penetrate to bony tissues, again we can see that Enterobacteriaceae and Pseudomonas aeruginosa had more than 50% resistance to this antibiotic, while Staph aureus had around 42%. And there is, as we can see, there is an overlap between the resistance. Just to mention also, the resistance of Enterobacteriaceae, during this study, we found 9 cases were resistant also to imipenem. So here we are talking about 50% of patients were resistant to first-line antibiotics, no difference per country of origin, and the number of previous surgeries tend to increase the first-line antibiotic resistance, but we have to interpret that cautiously because the large number of missing data. So in conclusion, it's obvious that there is a high rate of resistance to first-line antibiotics. It's well known that the treatment of this osteomyelitis is complex for MSF, and especially in a context around war zone, and requires multidisciplinary approach, including high-quality lab, skilled surgical team, strong antibiotic stewardship and infection prevention practices, as well as surveillance, monitoring, and really the electronic medical record supported us in doing this. Limitation of the study, it was based mainly on laboratory database and lack of the clinical data. That's why this study is followed by an ongoing prospective study to assess the consequences of drug resistance on patients' functional outcome. At the end, I would like to thank all the people who supported us in this study and Epicentre to give us this opportunity to do it from the distance. And thank you very much.